Piles is a disease which is very commonly present in every Indian, I should say, and it is present in every alternate Indians who is working. And piles, I should say, it is very common in corporate world also, because they are having dietary habits which is very uncommon. The commonest causes of piles are eating unhealthy foods, not eating food at the right time, or eating too much of a spicy food, too much of not taking non-fiber diet, which is very common if you are going on a fast food or going to eat pizzas, burgers, not many pizzas, burgers, and not eating fiber, wheat, roti, and everything else. What the common, I should say, what the common causes of piles are? Common causes are, it can be excessive straining on the piles, or not going to the motion daily, not going to the motion at the right time, not eating food at the right time, or not eating right food at the right. I should say right food at the right time is more important than anything else. Now, piles do take places. Normally, what happens is we have an intestine. We have a large intestine, a small intestine. Then the large intestine, there is a portion called rectum, and the rectum there is a portion called anus. That is called anal canal. So in the anal canal, there are pile masses are there, and it is covered with a mucosal lining. You can see a small lining it is present, and besides beneath that there are pile masses. So when we strain ourselves, or when the motion is hard, or when you are putting a lot of many pressure over that area, that lining gets slipped off over that area, over the pile masses, and gradually that pile masses goes on increasing over a period of time. It doesn't occur in a day or two, it occurs over a period of months, and we don't know what's happening inside. So we came to know only when symptoms develop, like we have a constipation or a bleeding or pain, or not able to pass motion, going to the motion number of times. The anal canal, and over it there's a lining. This is called mucosal lining, and these are the pile masses. Now what happens is, when we take where we are straining ourselves, or when there is having a constipation, this lining goes on increasing and becomes like this. So here now they become the pile masses, which goes on increasing in size, and one day what happens that this is the normal passage of passing a motion, this becomes too much small. Now when this motion passes to this small passage, which should be at this much size, this small passage, now the patient can have pain, can have bleeding, can have discomfort in passing motion, not able to pass the motion completely, which is a very common complaint that I am unable to evacuate completely. I am not satisfied with my motion. So this is the main reason, because this passage is small, and when a smaller quantity of motion comes out, the people are unable to evacuate completely. So the second commonest complaint which comes at that I am not having any constipation, I am passing a motion normally. This is a misnomer. The reason being it, when these pile masses are there, what happens that the fecal matter gets accumulated here, it gets degenerated and becomes a fluid. So a person passes a fluid over it, or a liquid fecal matter, and they think that they are passing a normal motion, but actually they are not passing a normal motion, they are actually passing a degenerated, or you should get fungated fecal matter. The rest of the matter is still lying inside. So over long-standing pile masses, long-standing piles can lead to a lot of many problems, which is the commonest is unable to evacuate, distension of abdomen, that gases are being formed, a colitis, which is the commonest disease seen nowadays. Colitis can develop. Fourth and third and the fourth degree piles, the best treatment is actually it is a minimal invasive procedure for hemorrhoids. It's called you can say a type of a laparoscopic procedure, or you can say in a layman term it's a laser type of procedure, which people call it the laser surgery. This is a non-invasive method. It's no cut is there, only a small gun is there which goes inside and cut the piles from inside. This is the stapler surgery, where there is minimal pain after surgery, minimal discomfort after surgery, minimal bleeding after surgery, and hospital stays only for a day, and out of office only for 2 days. After third day or fourth day, he can very well join the office. There is no need for any dressings to be done. There is no need for any bed rest to be done, and he can eat any food Besides that, small restrictions will be there, but he can do anything.